In the Ayurvedic sense, insulin resistance is an interesting state. It involves all the three physical dosh, that is, Vat, Pitta, and Kapha. Hi, good morning. We are increasingly seeing talks on carbohydrate. We are increasingly seeing talks on insulin. We are increasingly seeing talks related to these two subjects. Now, one of the most interesting phenomena associated is insulin resistance. Insulin resistance, one has to understand that why does it happen, when does it happen, or how does it happen. More importantly, we need to understand what insulin resistance is. Let's take it from the very simple perspective of English language. The two words insulin resistance means insulin is present and it is not being allowed to work or it is being resisted. This specifically happens almost to everybody and is a leading cause of type 2 diabetes. There is an age old saying that if you eat too much of sugar, you will become diabetic. That is true. True because over a long period of time, if you consume high amount of carbohydrates, the pancreas are forced to secrete more and more and more of insulin. With more and more and more of insulin, yet the whole carbohydrate is not utilized by the cells and the glucose does not enter all the cells to be metabolized. In that situation, the cells stop responding to the insulin present, which means insulin is circulating in your blood, it is there in your blood, but it is not working. So, presence of insulin in your blood not working, not reducing blood sugars levels means that you are a type 2 diabetic. That's how we analyze it through laboratory examinations. Corollary, insulin resistance will happen if high amounts of carbohydrates are taken over a long time. In the Ayurvedic sense, insulin resistance is an interesting state. It involves all the three physical dosh, that is, Vat, Pitta, and Kapha. Insulin or any hormone works by binding to a particular site, and if the cell is not recognizing that function, that means the binding is not happening. This not happening is all about Kaphaj failure. That Kaphaj failure may be due to a Pittaj alteration or due to any other reason within the Kaphaj context itself, but that it does not lead to metabolism or it leads to a metabolic failure is a sign of Pittaj failure. Both these also remind us of the fact that Vata is one of the essential elements responsible for signaling. And if signaling is failing, that means communication is failing, and the failure of communication is a failure of Vata functions. So, insulin resistance is technically a Sannipataj condition which may or may not be easily understood. That is why diabetes is terminal and it is rarely curable. When we say it is reversible, that means there is a predisposition of it coming back if the lifestyle changes are again reversed or not followed or any other consequential abnormal functions happen. That means consistency of a reversed lifestyle will be essential to sustain a diabetes reversal. That is the key to any diabetes reversal or diabetes management program post diabetes reversal. Thank you. Because of insulin resistance, it is quite often seen that there is an appreciable rise in weight. There are inflammatory changes within the body, within the blood vessels, within even the brain and other organs of the body. It can lead to dementia. It can lead to cardiovascular disease. It can lead to other lifestyle conditions, impairing even the functions of organs like thyroid. Impairment of organs like thyroid or any other endocrinal organs means that the complete metabolic cycle of that system and further on, the complete body will be impaired. Insulin resistance also leads to non alcoholic liver disease, or otherwise known as non alcoholic fatty liver disease, NAFLD. These are some of the common manifestations of insulin resistance, which we need to acknowledge and be careful about. Insulin resistance essentially shows up as a composite where number of factors will group together just because carbohydrate metabolism is impaired. That means it has to do with lifestyle. At the same time, insulin resistance, the cause, proves that carbohydrate metabolism failing because of too much of insulin secretion also indicates that the body is actually consuming a lot of carbohydrates. That means that is essentially a lifestyle problem. So, the correction of insulin resistance lies in change of a lifestyle. You need to cut, maybe zero down on carbohydrates for a short term and then keep carbohydrate intake reduced. You need to put yourself through a exercise routine which is fixed, and you need to understand and realize that it has been because of poor lifestyle that you may be seeing a drop in efficacy of all physical workout and not effectively leading to a weight loss. That also is a sign of insulin resistance.